Filipino nurses disproportionately impacted by COVID-19, study finds. It's interesting because here in the United States, we have a higher percentage of Filipino healthcare workers than Filipino percentage in the general population, which is very interesting. I think they probably maybe 1%, 2% in the general population, whereas in healthcare, I believe it's like probably over 19, 20% of Filipinos work in healthcare. A new report further reveals the devastating toll COVID-19 has taken on frontline healthcare workers, with Filipino-American nurses in particular dying at a disproportionate rate. A report released in September by National Nurses United, the country's largest nurses union, found that California is leading in COVID-19 infection rates amongst healthcare workers nationwide. The Golden State reported 35,525 infection cases, followed by Georgia at 17,317, and Florida at 16,380. California ranks third in overall healthcare worker deaths, behind New York and New Jersey. So let's go to the video. Let me get this here. Shut off my shut this off.
Well the negative effects of COVID-19. She caught the disease while treating infected patients.
I'm one of the lucky ones, but I still fear for a reinfection. I have a husband and 3 children at home.
It's a reality healthcare workers like her face every day, and the risk continues to grow. California leads in COVID infection rates amongst healthcare workers nationwide, with over 35,000 infections, according to data from National Nurses United. The report also found of all nurses who died of COVID in the U.S., 1/3 were Filipino, even though Filipino nurses make up just 4% of all nurses across the country. Does that concern you at all?
It does. A lot of Filipino nurses hold a lot of bedside positions. We are like right next to the patient when they get intubated, when they go into cardiac arrest. We are the first ones there.
West, whose mother was also a nurse, said the cultural stress of supporting multi-generational families in the U.S. and abroad may also explain why Filipino nurses are disproportionately affected. Nurses now speaking up, protesting work conditions they call unsafe. The largest nurses union in the country finding 87% of surveyed nurses reusing at least one piece of PPE, and only 23% of nurses getting tested for COVID-19 as of September. The report ends with pages of names, all frontline healthcare workers who made the ultimate sacrifice fighting the war against COVID-19.
It's a calling.
Reporting from Sacramento, Stephanie Lynn, KCRA 3 News.
That study found California ranked 3rd in healthcare workers dying from COVID-19. New York came in first with more than 300 healthcare workers killed by the virus, and New Jersey second with nearly 200 deaths.
Places your work above everything.